Good afternoon. I'm Dr. Jason Wingard, president of Temple University. Today I am here with my esteemed colleague, Dr. Tony Reed, Chief Medical Officer of Temple University. Welcome, Tony.
Thank you. Thank you, Jason.
So, Tony, today you and I are going to have a quick conversation about some trends affecting business, education, and society right now in the healthcare arena. So thank you for joining us again. So we're in the midst still of a pandemic caused by COVID-19. And there are vaccine policies that have been implemented at the government level, the state level, the city level, the university level. But there's a political polarization that is causing a cloud over the implementation of those vaccine policies. What can you say about both sides of why we are having difficulty with the vaccine, the mandate, the resistance to freedom of rights, and what does that mean and implicate for the future of public health?
That's an excellent question to start off with, Jason, and it really is, it zeroes in on exactly where we are in America today. You have, it's almost that age-old battle of capitalism versus socialism, you know, and do we as a society have the responsibility and the right to protect each other? Or is it the rights of the individual that outweigh everything? And so that is the very essence of what we're doing. Now, this is not the first time in history it's happened. It's not even the first ongoing issue right now. Gun control, abortion, reproductive rights. Germ theory started out this way. I mean, these are things that have come up in society over the past 200 years. And so I look at it this way. Kai Ruggieri, health policy professor at Columbia, who you probably know, published a study in 2020 that posed 5 scenarios. They were politically charged scenarios, and there was the favored party and there was the unfavored party. And in his study, what he found is that the perceptions that the favored party had about the feelings of the unfavored were greatly exaggerated. And so what that tells us is that in our minds, we think the opposition is more offended, more put off, more out there than what they really are. And it's that intuition that we all think we have, that if only we had the conversation, if only we had the back and forth dialogue, if only we stopped and listened to each other, then we may be able to quell some of this divide and move forward. And perhaps the answer isn't, is it a social right or responsibility or not? Perhaps the answer is, to what extent? And how do we walk that middle line of, let's protect everyone in the way they want to be protected?
So we're in the middle of a major urban metropolitan area, Philadelphia, Pennsylvania. Temple University serves Philadelphia and it serves the wider region by way of healthcare. What comes with being in a major city like this, there's all the urban crises that go along the healthcare spectrum, from homelessness to gun violence to addiction. So while all of those are serious and while all of those are unfortunate, it provides Temple University and the healthcare professionals an opportunity to provide the best-in-class training around trauma that there is in the United States. Can you elaborate on that?
Yeah, absolutely. And that's it's a great topic for us at Temple. It's a great topic in particular. Your book, The Great Skills Gap, gets into a lot of that, of how do we educate today's students to practice in tomorrow's businesses, and how do we adapt tomorrow's businesses to accommodate those students? And so, let me take those 3 things that you mentioned. Trauma. We have a world-class trauma team led by Dr. Amy Goldberg. We have world-class education out in the community with Scott Charles. I mean, these guys are out there in the streets with their team, walking the walk, talking the talk, and teaching medical students and nursing students and others how to engage in that, how to live that life, and how to work in that. And you move over to our addiction medicine side, from Joe DeRazio in the emergency department, David O'Gurick in family medicine, Breck Chumley in psychiatry, and a whole host of other people working out in the field, street medicine, with our teams, teaching our students the humility and the humanity of working to serve our fellow mankind. I mean, those are important lessons that we're doing. And then we have the social determinants of health. Kathy Reeves from the College of Urban Bioethics, Steve Carson from Population Health. I mean, these guys have teams that are out there, are teaching, are working, are serving the community. Our students of all of our health professions are going to graduate with that knowledge, not only how to treat patients where they are, but how to work together in teams to do those tasks that often seem impossible. I couldn't be more proud of our group as we go out there and we do that kind of learning.
So Tony, in addition to Philadelphia, the large metropolitan area that we've talked about, in this country, there are those who are insured and there are those who are uninsured or who are on Medicaid. We at Temple University and our health system serve both, but some health systems strategically decide that they are only going to serve those who are fully benefited.
Right.
Why do we stay on mission and serve those who are uninsured or those who are on Medicaid in addition to those who are fully insured, while others are proving profit and choosing profit instead of actually balancing both for a mission like we do? Why does Temple do that?
Quite honestly, 2 words: staunch determination. We see it as our mission and our purpose as, effectively the public hospital for the city of Philadelphia, to take care of those around us, regardless of their ability to pay, regardless of whether they're a have or a have not, regardless of where they fit in society. And so we teach our physicians, our residents, our students fiscal know-how, financial responsibility. We teach them solid clinical skills so that we don't perform unnecessary tests, so that we don't have a lot of cost overage and waste. We also give them the data so that they can know how to improve and how to get better. And we do these things better than most other places in the country. That kind of determination behind the scenes that sets up our frontline clinicians really makes a difference in the world. But then those frontline clinicians' determination to the mission, we think of it in terms of the, I think it's called the triple bottom line. It's not all about the profits. There is the sustainability, making sure that the environment around us remains where it is. But then there's also that commitment to social activism and really being out there and really making a difference. Again, it goes back to why we all came to Temple and what we look to teach and instill in our students. We've created in that kind of a subspecialty of medicine unto its own, serving the underserved and being highly professional about it.
So Tony, there's a talent war in this country. And as president of Temple University, one of the foremost questions I receive is, how are our students going to get jobs once they graduate? It's an area that I research quite heavily, as you know. And my question to you is, as a large organization, Temple Health, part of Temple University, how are you seeing parallels between what you are doing in the C-suite in terms of trying to attract the best talent, retain the best talent, provide a culture that the talent really wants and expects, just like all the Fortune 500 organizations are doing out in the world? One of the issues in particular, which you and I have talked at length about, is around that cultural element of being mission focused, being targeted around social justice issues. You can have an organization that does not have a stance on social justice issues. You can have an organization where the leadership is not transparent or authentic about their beliefs, their interests and views around social justice issues. Or you can do the flip, and you can have an organization and leadership that is very, very forthcoming about what we stand for and what we believe, and asking people, the employees, to engage in that way. What do we do at Temple, and is that helping us in the talent war?
I believe it is. Our students of today are our employees of tomorrow. And so I have a vested interest in our students beyond just teaching them and beyond just getting them through to a degree. My vested interest is these are the people who I want to retain as employees, as staff nurses, staff physicians, staff pharmacists, staff anything, who come on board to help continue to serve the mission. And so it's in my interest to help them fulfill their own desire and their own needs in the world of social justice. And we take it in a bunch of different ways. When you look at what we do with retention in staff, we're one of the best at retaining staff. Our turnover rate is less than half of what the average is in this country for turnover rate in health systems, because we allow our employees to be that kind of individual. Now, when you take it to specific items like diversity, equity, and inclusion, we have a very purpose and focused mission there, very specific activities that we go along there. When you take it to the streets, to trauma, it's very specific and very motivated and very driven. And it starts at the top. Using trauma as an example, I'm a loose peripheral to that, even as the CMO of the health system. But it's actually struck me at the core when my son was involved in a school shooting. And so to me, that's a driven mission. And that's something that is personal to me to make sure that we continue. We have others who have personal missions of a variety of topics from the C-suite, and we all push those. We all move those forwards. We all make sure that we continue to stay laser focused on those. At the same time, it also is helping our employees to be empowered to speak out in those kind of realms and those kind of opportunities. And I think that's critical for businesses. That goes across the healthcare industry and into other industries. This is where we are in our youth and society today. And we as senior leaders have to meet that demand.
The Paralympics concluded in Tokyo, Japan a couple of weeks ago. It was an awesome display of athletes with physical disabilities achieving at the highest level of performance. What have been the advances in sports medicine, your area of expertise, here at Temple and in the field in general, that are going to allow persons with disabilities to continue to perform the way these athletes did in Tokyo in the future?
Yeah, I mean, first of all, I'm impressed that you knew that, because I don't spend a lot of time, but I am still a clinically active sports medicine physician. And the Olympics are one of my passions. And so, let me start with a story. Åsir Christensen had limitations, physical limitations, created the company Åsir to build prosthetics. They are now the world's leader in building prosthetics for running and for other activities. And it's amazing. I mean, just the sheer talent. They can run really, really fast on Åsir's prosthetics. There's wheelchair companies that now focus on these high-performance wheelchairs that allow for that to happen. And then there's the human ingenuity, the rules changes, the rules modifications of something like para-equestrian or blind soccer that allow folks who previously this was not something they could dream of, now are able to compete at an extremely high level in ways that were never imagined in the past. And that kind of technology is happening all around us. The Temple University Lewis Katz School of Medicine just provided portable ultrasounds for every single first-year medical student. Now, what I see in that is 200 plus potential new sports medicine physicians that I can recruit, because that technology, that handheld technology out on the playing surface is powerful. It allows me to get a football player back on the field faster. It allows us to get a basketball player back on the court faster. I mean, that knowledge at our fingertips on the sidelines is incredible. And so the field of sports medicine is burgeoning with all of this, and I really am excited about the future in it.
Dr. Tony Reed, Chief Medical Officer at Temple University, thank you very much for joining us today.
Thank you, Jason.